Welcome to Healthy Living Hub. Today we are answering a question that worries many women. My period is late, but could something other than pregnancy be responsible? The answer is yes. Pregnancy is important to rule out, but it is not the only explanation. To help us understand the possibilities, I am joined by women's health clinician, Nurse Amma Mensah. Amma, thank you for being here.
Thank you, Abina. I am glad we are discussing this because a late period can create immediate fear. Menstrual cycles are controlled by communication between the brain, hormones, ovaries, and uterus. When that communication changes, ovulation may happen later than usual or may not happen in that cycle. That shifts the date of the next period. We will explain 5 common reasons, while remembering that persistent or severe symptoms deserve professional assessment.
Before we count them down, what does late actually mean? Many people expect their period on exactly the same calendar date every month.
A menstrual cycle is counted from the first day of one period to the first day of the next. Some variation is normal. Adult cycles commonly fall within roughly 21 to 35 days, and the length can move by a few days. A period is more concerning when it is clearly outside your usual pattern, keeps happening, or is accompanied by symptoms such as severe pain, very heavy bleeding, fainting, or unusual discharge.
Reason number 1 is stress. People often say stress can delay a period, but how can something happening emotionally affect the reproductive system?
When the body experiences major emotional or physical stress, it releases stress hormones such as cortisol. These signals can temporarily disrupt the brain hormones that help trigger ovulation. If ovulation is delayed, the period arrives later. Stress may come from examinations, grief, relationship problems, financial pressure, night shifts, poor sleep, illness, or intense worry. It is not imaginary, it is a real biological response. Improving sleep, eating regularly, and using healthy coping strategies may help the cycle settle.
So a difficult month can genuinely change the timing. What should someone do if stress seems to be the likely cause?
Start with a pregnancy test if pregnancy is possible. Then track your bleeding dates, sleep, symptoms, and major stressors. Gentle activity, regular meals, relaxation exercises, and talking with someone supportive can be useful, but do not blame every late period on stress. If periods repeatedly disappear, or you are struggling with anxiety, low mood, or overwhelming pressure, speak with a healthcare professional so both your menstrual health and emotional well-being can be assessed.
Reason number 2 involves changes in weight, food intake, or exercise. Why does the menstrual cycle respond to these changes?
The reproductive system needs adequate energy. Rapid weight loss, very low calorie intake, an eating disorder, or extremely intense exercise can signal that the body does not have enough energy for regular ovulation. Significant weight gain can also alter hormone balance and cycle timing. Athletes are not the only people affected. Sudden dieting, illness, appetite loss, or a major change in daily activity may be enough. The key is the speed and extent of change, not one particular body size.
That means missing a period after a strict diet should not automatically be celebrated as a sign that the diet is working.
Exactly, a missing period can be a warning that the body is underfueled or hormonally disrupted. Long-lasting menstrual loss may also affect bone health and fertility. Avoid crash diets. Aim for balanced meals containing carbohydrates, protein, healthy fats, fruits and vegetables, and allow recovery days when exercising. Anyone experiencing repeated missed periods, dizziness, weakness, a strong fear of food, or rapid weight change should seek medical and nutritional support without shame.
Reason number 3 is polycystic ovary syndrome, commonly called PCOS. What should viewers know about it?
PCOS is a common hormonal condition that can interfere with regular ovulation. Periods may be widely spaced, unpredictable, or absent. Some women also notice acne, increased facial or body hair, thinning scalp hair, difficulty managing weight, or challenges becoming pregnant. Not everyone has every symptom, and having an irregular period alone does not prove PCOS. Diagnosis may involve a medical history, examination, blood tests, and sometimes an ultrasound, while excluding other causes.
There is also a lot of confusing information online. Does the word polycystic mean every woman with PCOS has dangerous ovarian cysts?
No, the name is misleading. The ovaries may show many small follicles which are immature egg-containing sacs, but these are not the same as dangerous cysts. Some people with PCOS do not show that ultrasound appearance at all. Management depends on the person's goals and may include lifestyle support, medicines to regulate bleeding, treatment for acne or excess hair, and fertility care when needed. A proper assessment is much safer than self-diagnosing from social media.
Reason number 4 is a thyroid problem. The thyroid is in the neck, so how does it affect menstruation?
The thyroid gland produces hormones that influence metabolism and interact with reproductive hormones. An underactive or overactive thyroid can make periods late, irregular, unusually light, or sometimes heavy. Other clues may include unexplained tiredness, feeling unusually cold or hot, constipation, a racing heartbeat, tremor, changes in weight, dry skin, neck swelling, or changes in mood. These symptoms overlap with many conditions, so a blood test is needed. Symptoms alone cannot confirm a thyroid disorder.
If someone has several of those signs, should they buy thyroid medicine or supplements themselves?
No, too much thyroid hormone can be harmful, and iodine or herbal products are not safe substitutes for assessment. A clinician can review the symptoms and request tests such as thyroid-stimulating hormone and, when appropriate, free thyroxine. When a thyroid disorder is correctly treated, menstrual cycles often improve. Seek urgent care for severe palpitations, chest pain, breathing difficulty, confusion, or fainting rather than waiting for the period to return.
Reason number 5 is medicines and hormonal contraception. This can surprise people, especially when they stop or change a method.
Hormonal contraceptives can intentionally change bleeding. The injection, implant, hormonal intrauterine system, and some pills may cause lighter periods, irregular spotting, or no bleeding. After stopping certain methods, natural cycles may take time to re-establish. Other medicines, including some used for mental health conditions or cancer treatment, can also affect menstrual hormones. Never stop prescribed medicine suddenly. Ask the prescribing clinician or family planning provider what bleeding changes are expected and when testing is needed.
Let us address the biggest question. If someone is sexually active and the period is late, when should she take a pregnancy test?
If pregnancy is possible, take a home urine pregnancy test from the first day the period is missed, following the kit instructions. First morning urine may be helpful when testing early. If the result is negative but the period does not come, repeat the test after several days or speak with a healthcare professional. Tests can be falsely negative when taken too early, used incorrectly, or performed with very diluted urine. Contraception reduces risk, but no method is completely perfect.
Which warning signs mean a person should not simply wait at home?
Seek urgent medical care for a late period with severe or one-sided lower abdominal pain, shoulder tip pain, fainting, marked dizziness, or heavy bleeding, particularly if pregnancy is possible. These can be warning signs of an ectopic pregnancy or another urgent condition. Arrange a routine assessment if you miss 3 periods, if irregularity keeps recurring, if you have troubling PCOS or thyroid symptoms, or if the change follows rapid weight loss, excessive exercise, or an eating problem.
Amma, please give us the 5 reasons once more before we close.
The 5 are significant stress, rapid changes in weight, nutrition, or exercise, polycystic ovary syndrome, thyroid disorders, and medicines or hormonal contraception. Other life stages and health conditions can also change the cycle, so this list is not a diagnosis. Track your periods, test for pregnancy when relevant, and seek care when the pattern persists or warning symptoms appear. Your menstrual cycle is useful health information, not something you need to feel embarrassed about.
Thank you, Nurse Amma, and thank you for watching Healthy Living Hub. If this video helped you like it, share it with someone who may need reassurance, and subscribe for clear, practical health education. This program provides general information and does not replace assessment by a qualified healthcare professional. Take care of yourself, and we will see you in the next episode.